Board of Health meeting. Due to COVID-19 pandemic, regional council is practicing physical distancing and councillors are participating electronically, except for Councillor Shantz and myself who are in the chamber. I would like to acknowledge that the land on which we gather today virtually is the traditional territory of the Haudenosaunee, Anishinaabe, and Neutral people. We acknowledge the enduring presence of the Indigenous people with whom we share this land today, their achievements, and their contributions to our community. What my Indigenous fellow travelers have taught me is that our relationship to the land should be one of stewardship rather than ownership, and I honor that concept. I will now turn to Stevie Natalachny to do the roll call.
Councillor Armstrong. Councillor Erb.
Present.
Councillor Foxton. Councillor Galloway.
Present.
Councillor Jaworski.
Here.
Councillor Jowett. Councillor Kiefer.
Present.
Councillor McGarry.
Present.
Councillor Nowak.
Present.
Councillor Shantz. Councillor Vrbanovic.
Present.
Chair Redmond.
Present.
And we have received regrets from Councillor Clark, Harris, Lawrence, and Strickland.
Thank you, colleagues. I will now entertain a motion to reconvene an open session. As moved by Councillor McGarry, seconded by Councillor Jaworski. Please use your icons to vote yes or no. So we are now reconvened as the Board of Health into open session. Are there any declarations of pecuniary interest under the Municipal Conflict of Interest Act? Seeing none, and we have no registered delegations, I will now turn the floor over to Dr. Wang, our Medical Officer of Health, to give us a COVID-19 update. Welcome, Dr. Wang.
Thank you, Chair Redmond. Good afternoon, councillors. Thank you, Kathy. If you could go to the next slide, please. I'd like to start my presentation with my key messages, 3 key messages. 1, our public health and healthcare indicators continue to improve or stabilize, and our vaccination rates have increased rapidly. Thanks to our residents and vaccine staff, partners, and volunteers, our vaccine ramp-up was a huge success. Waterloo Region will advance to Step 3 along with the rest of the province this Friday. The second key message is that Waterloo Region residents are strongly encouraged to get their second dose of vaccine as soon as they can. Delta continues to circulate, and Step 3 will increase the risks of spread. And the third key message is Ontario will remain in Step 3 until 80% or more of the population aged 12 and older has received 1 dose, and 75% or more of the population aged 12 and older has received a second dose, and other key public health and healthcare indicators remain stable. Next slide, please. A little more regarding our current trends. As mentioned, our indicators continue to improve or stabilize. Our weekly incidence rate is now back to the rates we were seeing in March 2021, prior to the start of the 3rd wave. The number of active cases and outbreaks is decreasing. Hospitalizations and ICU admissions are stabilizing. Delta continues to circulate in our community and remains a threat. In addition, with the lifting of a number of restrictions in Step 3, we can expect that the risk of Delta spread will increase. This is why we must continue getting vaccinated as quickly as we can. and we must continue to practice public health measures diligently. In particular, avoid closed spaces, especially with poor ventilation, and crowded places. Outdoors is safer than indoors. When indoors, ensure well-ventilated spaces, masking, and distancing. At an individual level, be cautious as you add activities for yourself and your family. Think about your contacts and who you would need to identify if you are exposed to or contract COVID-19. Think about those in your life who are at risk, such as those who are most at risk for serious illness as a result of COVID-19 or who cannot yet be vaccinated. Next slide, please. Thanks to our community, our vaccine ramp up was a huge success. We now have one of the highest first dose coverage rates in Ontario, and we have made major strides on second dose coverage. But we can't stop now. Waterloo Region residents are strongly encouraged to get their second dose as soon as they can. If you have an appointment booked in August, September, or later, please move up your appointment. You may book as early as 28 days after your first dose if you receive Moderna or Pfizer. You may book as early as 56 days after your first dose if you received AstraZeneca. If you know someone who is holding on to a later appointment, please help them move their appointment up. We are aware of comments made by the World Health Organization's chief scientist that were taken out of context on the mixing of different COVID-19 vaccines. Ontario continues to advise Ontarians that mixing the mRNA vaccines, Pfizer and Moderna, as well as the mixing of AstraZeneca and an mRNA vaccine is safe and effective, and enables people to get their second dose sooner. This is consistent with advice from the National Advisory Committee on Immunization, and we also have data from Spain, Germany, and the UK showing that mixing vaccines is safe and effective and provides a robust immune response. Full immunization, 2 doses plus 2 weeks, is our best protection against COVID-19, including against the Delta variant. Please don't delay your second dose. Last slide, please. Moving beyond step 3. As mentioned, Ontario will remain in step 3 until 80% or more of the population aged 12 years of age and older has received 1 dose, and 75% or more of this same population has received a second dose, and other key public health and healthcare indicators remain stable. So it's important that we do not let up now. Not only to be able to achieve the next step of reopening, but most importantly, to protect ourselves as much as possible from the Delta variant. We are seeing what is happening elsewhere in the world due to the Delta variant. Infections surge and restrictions need to be reinstated or reopenings need to be delayed. We have to seize the opportunity now, when we have plenty of vaccine and vaccine appointments, to protect ourselves and our community against Delta and continue along our path of reopening. Our community has stepped up in such a big way to get vaccinated, which has made our rollout a big success. I am immensely grateful. We need our community's continued help. The higher our immunization rates, the better protected we will be, and the less we'll need to rely on restrictions to keep us safe. And last but not least, to our residents, be cautious as you add more activities for yourself and your family. Think about your contacts and who you would need to identify if you are exposed to or contract COVID-19. And think about those in your life who are at risk, such as those who are most at risk for serious illness as a result of COVID-19 or cannot yet be vaccinated. Thank you.
Thank you, Dr. Wang. Councillor Foxton, is this a question for Dr. Wang? Okay, please go ahead.
Yes, Chair, and through you, children under the age of 12, I believe there's been some research done for vaccinating them. Have you heard anything yet?
There are trials that are underway, and we hope that the trial results will be ready towards the end of September, at which point they would then go to federal authorities, in this case, Health Canada, for approval. And so we're hopeful that we could see approvals for vaccines for children 5 to 11, starting sometime in October or possibly November.
Thank you. The next question I have is, you talk about the mRNA vaccine, and we as council have heard it numerous times, but I think the public, if you could clarify for that. So
Yes.
What's an mRNA vaccine? Which ones can copulate together? Which ones can't?
Yes. So the two mRNA vaccines, I have trouble too, are Pfizer and Moderna. They're like twins. They're both mRNA vaccines, which means they use the mRNA technology to provide immunity. They have similar safety profiles. They have similar efficacy rates. In fact, they are the two most effective vaccines in the world. And the National Advisory Committee on Immunization, as well as the Ontario government, have determined that they are safe and effective to interchange with one another. So
two more questions. What's happening with Lambda? Is it Lambda or Lambda, the new one?
Lambda. Lambda is considered a variant of interest. So it's a variant that World Health Authorities, including the Canadian ones, are watching. It's not yet considered a variant of concern in that we don't have evidence yet that it is more transmissible and or more severe, but it's being watched closely. There are always variants that appear. It's a natural course of how viruses evolve. And so, I know that Canada and Ontario is watching closely what this particular variant is doing. There are many, many variants actually that don't amount to anything really. They don't end up becoming more severe or more transmissible. So time will tell what will happen with Lambda. We have to remain vigilant.
And that's helpful because the rumor mill has it that it's worse than Delta. And I didn't think it was, so I needed you to clarify that. The last question is, do you believe we should be concerned about wave 4? I believe it was televised on the news last night.
Yes, so. Dr. Kieran Moore said that he expected that we could have a surge. Yes. Well, anytime you have more social contacts and less restrictions, like when we advance in the reopening phases, and also when you start to get into seasons of the year when people spend more time indoors, you always have a greater risk. That's correct. But a greater risk doesn't have to amount to a real surge or a real significant impact to our community, to our healthcare system, if we can control it. And the best way to control it is through vaccination. And until we have high levels of first and second doses in our community, to continue with those practices of distancing, masking, avoiding crowds, avoiding enclosed spaces that are not well ventilated.
Thank you. That's important to know, and that the public understand that wave 4, if it does come, may not be horrendous if we vaccinate and make sure everybody that can vaccinate gets vaccinated, and that we're cautious. So wave 4 may not be horrendous. Thank you very much.
Thank you.
Thank you, Councillor Foxton. Councillor McGarry, please go ahead.
Thank you, and through you, Chair, to Dr. Wang. Thank you very much for bringing this report forward and for all that you and your team are doing. Very exciting to see the number of people that came out to get vaccinated, and a quick in and out from all we hear. So congrats to the team. The question I have is really regarding some of the caution that you are still flagging for our community, and rightfully so. I know that I'm hearing about some of the outbreaks that are occurring among people that are already double vaccinated and sometimes over the 14 days when the full immunity takes effect. Are you able to speculate or inform our community about some of those dangers? I think generally speaking, people feel like I do, I'm now double vaxxed, that I may be impervious to COVID-19. And yet recently there was an outbreak at one of our Eastern Ontario hospitals where 12 individuals were affected, staff as well as patients, and some of whom had had double vaccinations. Could you just sort of speak to some of the science around that? Thank you.
For sure. Thank you for the question, Councillor McGarry. So the vaccines that we have are the best in the world. They're the most effective, but they're not 100%. And when you have more and more people in our population that are immunized, if you have Delta circulating, you will have a lot of exposures. The vaccine will prevent a lot of cases that you don't see, but it won't prevent some cases. And therefore, as you have more of our population immunized, you will see more cases among people that are partially vaccinated, as well as to a lesser extent, fully vaccinated. But the thing to keep in mind is you can't just look at the number of partially or fully vaccinated people that were infected. You have to look at the denominator, how many people were exposed. If you take a vaccinated group of people, or at least partially vaccinated group, versus a group that's non-vaccinated, for the same exposure level, you're going to get many more people in the unvaccinated group who will become ill. But that's why it's important to, at a community level, keep immunization rates as low as possible, because if it circulates, it will continue to try and infect people. And, partially immunized people are not optimally protected. And even when you are fully protected, there is a small risk. And the risk is always going to be higher in people that are more frail, elderly, have other health conditions that make them more susceptible to complications. And so, you can see, unfortunately, more people like that experience more severe impacts if they're infected. But at a population level, a vaccine, even one dose, actually is quite protective against serious complications like hospitalizations and death. And also, if you do get infected, you will tend to have less severe symptoms, as well as less ability to transmit further on. So all in all, being vaccinated will protect you, and being doubly dosed will protect you the most. But that's the reason that we all have to still remain cautious until we have really very broad community immunization, very high levels of immunity in the population, so that the risk, or actually the circulation of Delta, slows. And that's why we have to keep up with those measures that are like an additional layer of protection. And, for people that, what the Chief Medical Officer of Health Ontario said yesterday, for people that, in general, they should avoid, even if they've been vaccinated, they should avoid crowding, they should avoid, indoor spaces that are not well ventilated, they should They should avoid those things that we know are going to continue to put you at risk, even if you are partially or fully vaccinated. So hopefully that provides a bit more information on the fact that, it's not absolute and we still have to be careful.
Councillor McGarry, do you have any further questions or comments?
No, I think I would like to comment, though, Chair Redmond, that I think this is very important information for all of us to continue to amplify in our social media and our dealings. I know that there's a huge amount of community pressure for us to suddenly open everything else up. And that now that we're in step 3, we can either get back to council chamber, get back to indoor events, or why can't we do all these things? And I think you've highlighted again, the fact is that we're fully vaccinated. And we will likely avoid serious illness, but that doesn't mean that we're out of the woods. And as a matter of fact, there's even children are not vaccinated under age 12 against COVID, let alone the Delta variant. So I think you bring up some good points, and thanks very much for your clarification.
Dr. Wang?
If I could just quickly add, well, now what we're seeing across the world is exactly that, Councillor McGarry. When there is a very rapid loosening of restrictions, in particular, no more, distancing and masking, country after country, what we see is this significant major surge of Delta that comes next, right? So that's actually why the Ontario strategy of being stepwise in their reopening it has advantages over what we've seen elsewhere. Thanks.
Thank you, Dr. Wang. Councillor Galloway.
Madam Chair, Madam Chair, I've got a few questions. Dr. Wang, you mentioned the 2 of the criteria that the province has now announced for coming out of step 3, whenever that may occur, the 80 and 75. Now, I understand there was a 3rd criteria, which is that no public health unit in the province could be less than 70%. Is that also correct?
That's correct.
Do you see anywhere in the province where that is likely to be a problem?
There are some health units that are more behind on 1st or 2nd doses. And like you said, the 3rd criteria really relates to 2nd doses. It's at least 70% of those 12 and older have received a 2nd dose. We have approximately 3 weeks to reach that goal.
We'll reach that goal. We're going to reach that goal.
We're on track. We're on track.
Is there any other public health unit in the province? I mean, maybe you haven't looked at those numbers. If you haven't, that's fine.
There are some that lag and could have more of an uphill road for that. But for all of us, it's going to be all hands on deck. One of the most important things actually to be able to achieve our targets is to have people move up their 2nd dose, because if we don't, we're not going to, be able to administer as many vaccines. And so that's why, that's going to kind of be our key message over and over again in the next little while, because we need all those people that are, scheduled for later in August, September, and October who were originally scheduled with that 4-month timeline to move up their 2nd dose. Now we have plenty of vaccine and appointments to accommodate them. And that's how we will reach those thresholds.
So one of those criteria is 12 plus 2nd doses, 75%. Now we aren't, unless I can't find it, we aren't currently showing that statistic on our dashboard.
Right. Yes.
Are we going to add that?
Yes. Bruce will speak a little bit more about that, but yes, it will be added, so we'll be able to track.
Because there are actually more people in the public that I've found out that refer to the dashboard on a pretty regular basis, and a couple of people have mentioned that that's a statistic that currently isn't provided. I mean, you can extrapolate from the first doses pretty close, but it'd be nice to have that. Now, in a somewhat similar vein, and maybe Bruce is going to deal with this as well, another piece of information that, again, I can't find and others don't seem to be able to find on our dashboard is any kind of longitudinal information on hospitalization and ICU occupancy. There are daily numbers, but there's no graph or curve that shows a trend that I'm aware of.
Yeah. Those numbers really aren't ones that we have access to. The numbers that are on our dashboard are provided to us from the hospitals. And the hospitals, they have also received questions about trends. And so what they're doing now is once a week, they provide an update, usually through Lee Fairclough, president of St. Mary's, on the hospital trends. And so, that's something that they'll be regularly providing an update on, but it's not data that we have access to. And also it requires some interpretation due to, needing to have some expertise on interpreting what the trends mean, because it could be beds opened and,
well, that's a good point.
Yeah.
But on the other hand, we do publish a number every day. We just don't put it into any kind of chart. So, 15 today, 14 tomorrow, 17 the next day in terms of ICU beds. People can't see if we're going up or down unless, of course, they remember from yesterday what the number, what yesterday's number was. So, yeah, I do understand that the hospitals, have that data, but I'm still wondering whether or not we can put it into some kind of chart or graph form so people can follow the trend.
Sorry,
okay, I'll take that back.
Okay.
I'll take that back to our data team.
That's what Mr. Lauckner was just going to say. If we can use that as a takeaway, Councillor Galloway, we'll take it away.
That's great. Earlier today, I think it was, or yesterday, I think the Solicitor General said that the province of Ontario is not going to be considering vaccine passports, and that the paper copies will be sufficient, and that may change. But I'm already seeing businesses and other kinds of establishments that are making vaccination a requirement to get in. So there's some gyms that are apparently going to make it a requirement. Some bars and hospitality places are going to make it a requirement, or at least they say they're going to be making it a requirement. Mm-hmm. So is the province of Ontario providing any guidance, or is the local public health unit providing any guidance to owners if they were to ask, is this a good thing to do or a bad thing to do? Now that people are reopening, there are many people in the community that only want to go to places where full vaccination is a requirement. So I'm wondering whether or not there's any guidance available from the province or from the local PHU on whether or not that's something that should be promoted or discouraged, or we just have to leave it up to each and every owner to determine what's best in their particular circumstance.
So Dr. Wang, Mr. Lauckner is ready to weigh in, and then I'll see if you want to add to it, okay?
Perfect.
Thank you. Through you, Madam Chair. It's a great question, Councillor Galloway. The Solicitor General commented on that today, that they will be leaving this to the federal government. This is a federal government responsibility to clarify, given the myriad of potential issues related to the ability for businesses to do that. So we expect the federal government to comment, and once we receive clarity, we'd be in a better position to comment locally.
Dr. Wang, did you want to add anything? Okay. Councillor Galloway, any further questions?
No, that's it. Thanks very much, Madam Chair.
Thank you. You know, every time we post those numbers, I know that you are right there looking at them. So I appreciate your vigilance. Councillor Erb.
Thank you, Madam Chair. I simply wanted to acknowledge and thank Dr. Wang and all of those people who were involved in the very difficult decision she made a couple of weeks ago to keep Waterloo region in stage 1, and then the hard work of staff, the community, volunteers, and the people responding to the vaccinations. And I think that decision we can clearly see was the right one. And I commend her for that, and for the community to responding in such a positive way. And I really hope going forward that somehow there's a strategy and a listening and an understanding on behalf of the community, just the importance of getting those vaccinations, because in the last 2 or 3 weeks, we've proved the difference it can make in our community. We need to continue getting that message out and getting as many people vaccinated as possible. So thanks, Dr. Wang and staff, for that difficult decision and getting us to the point where we be.
Thank you very much.
Thank you, Councillor Erb. I think you've reflected certainly the feelings around this virtual horseshoe and in our community. Deputy Chief Hilton is unable to join us today, so in her place, I'd like to call on CEO Bruce Lauckner for an update about the local vaccine rollout. So, Mr. Lauckner, you have the floor.
Thank you, Madam Chair. And Deputy Hilton is irreplaceable, so I will try to do her shtick justice today. A huge thank you to the community. When I think back not too many weeks ago, we really needed more vaccine. And through our advocacy efforts and the advocacy efforts of Council and Chair Redmond, we were able to receive more vaccine from the province. So a shout out to the province for sending us more vaccine in our time of need. None of this could have been accomplished without our residents willing to step up and come to the available slots. So our vaccine ramp up has been a huge success. I know, as Councillor Galloway talked about the numbers, that this council not only rolled up your sleeves to get vaccinated yourselves, but actually participate in rolling up your sleeves to volunteer at various clinics, whether it was Pine Bush or the Boardwalk or Binghamans and Kitchener this weekend. So that says a lot about this council, who's willing to step up and do the frontline work as well. I had a chance to go out and do a couple of shifts Saturday night. It was a little slower than the busyness of the morning, but still so many people coming through, especially after the soccer game. And it was great to see leaders from different organizations in the community volunteering. I ran into Linda Kenny from Kids Ability at the door one night. I ran into another retired school teacher who just said, I just had to come out and contribute because this is what Waterloo Region is all about. So it was a happy place and great to see so many people get vaccinated. Over 20,000 more residents got vaccinated, breaking a two-day record. We now have one of the highest first dose coverage rates in Ontario, almost 80%, and we've caught up at light speed to the rest of the province for second doses, more than 50%. I think when we look at the numbers today, 18 plus, we're at something like 56% of adults vaccinated. So great news. And in the coming weeks, as Dr. Wang has said, anybody who wants a vaccine, a second shot or a first shot in this region can get one. With respect to the dashboard questions asked earlier today, we will be updating our dashboard. I anticipate that will be out and updated by Friday to reflect our focus on vaccinating all eligible residents, that being 12 plus. And we will show those stats on the main page as opposed to the focus only being on 18 plus. So you'll see the 12 plus being depicted on the main page. There'll be some slight changes to the numbers. As we vaccinate more of our 12 to 17-year-olds, that number will increase in the days and weeks ahead. And again, really proud that we're one of the provincial leaders in vaccinating that age group. I do know that some people are saying, hey, why can't we vaccinate everybody this week? We have to remember that people have to wait their number of weeks after their first dose. So we did vaccinate. I remind the public that we did vaccinate some people in the middle of June and the end of June. They can't be vaccinated this week. They need to wait until the middle of July and end of July to get vaccinated. I would ask that anybody who does have appointments, and we actually do have people who have appointments in August and September, if you're eligible, in other words, if you got your vaccination, say in June, please advance your appointment. Please get vaccinated in July, and that will free up our appointments for those who need it in August. And again, get to Dr. Wang's point of getting us to that 80% target and 75% target as soon as possible. In terms of operational update, our vaccine supply remains steady. We have less Pfizer supply and mostly Moderna coming in from the province. Vaccine clinics will continue to run at max capacity. I do anticipate that will start to slow down at some point in July as our numbers dwindle with, maybe said more positively, as more people get their second doses, there's less demand on our clinics, and that's a good thing. Binghamton's will continue to run until Sunday with the hockey hub model, and next week we'll start to shift from that hub to offer more drive-through clinics, again in partnership with Binghamton's because they have such a good amount of space there to allow us to get traffic in off the roads and do more drive-throughs. A reminder, first dose walk-in clinics are always welcome at all of our clinics. When we have the opportunity for second dose walk-ins, we've advertised those on social media, and we've had great uptakes, and we've had some community partners, Vaccine Waterloo on social, who have really helped us out. They're really all over this. There's availability at this pharmacy or availability at this clinic. Please come now. And again, the community has responded. Continued focus on community. There is a point, and we'll start to see that if we already haven't, where people who would prefer a different methodology of getting their vaccine and maybe wouldn't come to our clinic normally. We will continue to respond to that and ramp up our mobile clinics. We are adding mobile clinics to support our businesses as well, and also increasing our support to ParaMed, which is a home and community care agency, who are helping us vaccinate those who are housebound. We're constantly looking at the data to identify those areas where we could benefit and where residents could benefit from more pop-up clinics. And that work will continue to expand in the coming weeks again as we need to go to more and more people in our community. This includes continued work to address vaccine hesitancy through communications and community engagement. And before I take questions, if you can indulge me, pleased to have Fauzia Baig and Sharron, who I believe have been in front of council before, to present on some of the work that they've done as our vaccine rollout leads for community engagement. So over to you, Ms. Baig and Ms. Ord, and I'm happy to take questions after. Thank you.
Welcome, Fauzia and Sharron. Who's going to start off? Is it you, Fauzia?
I think it is. I'm just waiting for, I guess, the PowerPoint. Sharron, are you sharing that?
I am, Fauzia. Can you see it yet?
No.
Not quite. All right. One more button, and I think we're good.
We're there.
Thank you.
Perfect. So thank you. Hello again. My name is Fauzia Baig. As you know, Mr. Bruce Lauckner has just introduced me, and I'm happy to be here to give you an update on the community engagement outreach work that's been happening throughout the vaccine rollout. Next slide, please. So from the start, our approach has been to use both data and community feedback to inform our response to bring vaccine information and clinics into community settings using a co-planning model. To do this, we have focused on building relationships and trust by continuing ongoing communications and conversations to understand changing community needs. This trust is built over time when we continue to listen and remain open to feedback and commit to doing things differently based on what we've heard. We continue to make new connections with different community leaders with the same goal in mind, to better understand the needs and find opportunities to co-plan responses that would meet these needs. A lot of progress has been made to date, but there still is more work to be done. This will require dedicated resources and commitment to continue working with community to bring vaccines to them in ways that meet their need. Next slide. The Community Engagement Working Group has continued to meet since January and provided input into vaccine rollout at our fixed sites as well within the community-based approaches. Members of the Community Engagement Working Group continue to update their respective networks and community groups. This group has made recommendations to ensure vaccine clinics better represent the diverse needs of our community. This including diverse healthcare professionals at clinics representing the community, offering culturally safe care at all clinics, which requires training and orientation for clinic staff, removing barriers based on language, accessibility, AODA, transportation. For example, we have offered free bus passes. I think we've mentioned this a few times before, but we did expand even to include where these bus passes were available. We offer them at welcome spaces and then again at the working center in partnership with their team. And they're also available at clinic sites. The group has also made recommendations in removing barriers based on addressing vaccine misinformation. So by organizing vaccine information sessions with community partners in various languages with diverse healthcare professionals and leaders, ensuring tailored and diverse communications are available. We recently ran radio spots on ethnic radio stations on CKWR for the last 2 months. Community-specific information sheets on vaccines, translated resources, and videos are just a few that this group has worked on. Next slide. The Community Engagement Working Group has also helped to promote the event. Has also helped, let me just see where we are. Yep. The Community Engagement Working Group, has also helped to promote large events like the Binghamton's Every Dose Matters or Every Dose Counts. And they do this by providing input into, they do this by promoting the event through connections to community leaders, providing feedback. For example, we did create a culturally safe care tip sheet for staff and volunteers at the clinic. They themselves volunteered at the event and shared the volunteer opportunities through their networks. We had a great turnout of different community leaders representing our diverse backgrounds and language abilities in our community. Next slide. I'm going to talk about our high priority community clinics. This is also work that has come out of the Community Engagement Working Group in consultation with community leaders and community organizations. In all of our high priority vaccine clinics, we have used a co-planning model. For example, at the Indigenous clinics, this was planned in partnership with Anishinaabe Outreach, the Healing of Seven Generations, KW Urban Wigwam, and SOHAC. In addition, we've also partnered with SOHAC in having an Indigenous immunizer located at Pine Bush ongoing. So this will be available even after the Indigenous clinics come to a close. Our refugee clinics were planned in partnership with Sanctuary, KDCHC, Reception House, KW Multicultural Center, and it was intentionally located at the Kitchener Market in order to provide a co-location of the clinic with Sanctuary services. In terms of our high priority neighborhood clinics, these were co-planned with community leaders who know the communities and organizations who serve the communities in Kitchener, Waterloo, and Cambridge. The locations were based on public health, COVID, and social determinants of health data, coupled with feedback from community leaders. KW locations included Chandler Mowat in Country Hills for the Alpine Laurentian neighborhood, Victoria Hills Community Center for the Victoria Hills Cherry Hills KW Hospital neighborhood, Kingsdale for the Vanier Rockaway neighborhood, Country Hills and Albert McCormick as well, and Albert McCormick was for the Sunnydale and Columbia Lakeshore neighborhood. 6 clinic locations offered 2 rounds of appointments. We started on April 26th and ran until May 14th for the first round, and then went back to these community sites May 31st to June 18th for a second round of first dose appointments. The Cambridge locations included in the Shadesville neighborhood, we were at the Cambridge YMCA in the town line Gurdwara in the beginning of April, and then again in between May 17th to May 28th. Currently, we are working on moving up second doses at these community clinics. We are running clinics and all these high priority clinics to provide opportunities to provide shortened second doses to anyone who was vaccinated and received their first dose at these clinics. Next slide. Based on feedback from the community, these community clinics include language line or in-person interpretation for some clinics, for example, in the refugee clinic, ceremonies and traditional medicines in our Indigenous clinics, privacy screens and space for larger family vaccinations, immunizers from the community at these clinics, community organization, community leaders and volunteers' presence at the clinics, and outreach and booking support provided by community leaders and other grassroots organizations that know and serve priority communities in Waterloo region. Next slide. For ongoing outreach, we've continued our outreach efforts. An example of our ongoing outreach is our work to better serve the rural and Anabaptist community. We have continued meeting with rural community leaders since January to discuss emerging needs and appropriate responses. Rural leaders have continued to check in with religious and community leaders in the Anabaptist, Mennonite, and rural communities to get a pulse on the needs. Based on feedback, some communication items have been developed and disseminated. Examples include developing a vaccine information sheet based on community leader input that was mailed out to all rural postal codes. In addition, Low German videos on vaccine information, registration and clinic information, and testimonials were created, posted, and shared. This work is currently ongoing. Next slide. To continue our equity-led approach, we have also planned smaller, tailored vaccine responses. These responses are based on consultations with community leaders and organizations to provide flexible booking options, for example, a combination of booked appointments and walk-ins. The clinic could be as small as 20 vaccinations based on the need, or as large as 150, and is located at a site most accessible to that community. It can combine other outreach efforts. For example, we have piloted bringing HPAR nurses, which is Health Professionals Against Racism. It's a new organization of nurses that have come together. So we have partnered with them to bring HPAR nurses to food distribution for residents to ask questions and then book appointments in real time if they felt comfortable. The feedback on this approach has been very positive, and we're looking at ways to continue to expand. Again, a lot of progress has been made to date, but there still is more work to be done, requiring resources, commitment, and an openness to work in ways we may not have in the past. In order to continue working with community to bring vaccines to them in ways that meet their needs. Thank you.
Thanks, Fauzia. Over to me. I appreciate the opportunity to update the Board of Health on the region of Waterloo's What's Your Why campaign. Dates running from June 14th to August 6th. We launched this campaign in mid-June to encourage more people to book an appointment for the first dose of the COVID-19 vaccine. With this campaign, our goal has been to support the vaccine rollout to achieve an 80% vaccination rate for first and second doses. We've engaged local influencers to share with their peers and the broader community their reason for getting vaccinated. There is a common thread in the stories our influencers are sharing. Each person hopes they will soon be able to return to the activities they enjoy. Members of the public are encouraged to share their own stories and reasons for getting vaccinated and to post on social media platforms with the hashtags TeamVaccineWR and What's Your Why WR. We're seeing good traction on social media with an estimated reach of almost 850,000 and more than 15,000 likes and interactions so far. Also, over the last 4 weeks, we've seen 97,000 first-time visits to the Book a Vaccine page on our website. We are reaching the community through a mix of digital and traditional media to encourage vaccination. In addition to social media, we are running newspaper ads in 6 of our local newspapers, radio ads on 4 local stations, and outdoor advertising in ion stations, bus shelters, and at the airport. As the green lines in this spreadsheet indicate, our media buys are deliberately staggered to maximize resources and impact over an 8-week period. Not sure this is showing what I'd hoped. There were some things on it, but I'll carry on. For our outdoor advertising, we've been able to use geographic information systems, or GIS, to target vaccination areas identified by the public health epidemiology team. We've also been able to position our influencers in the neighborhoods where they'll have the most influence. And if you're looking at the screen I'm not sure where the people went, but we were able to put a teacher from St. Mary's High School near her school, and she has a great deal of followers on TikTok. We also had a business leader positioned where he owns his own business. So we've been able to do some pretty nifty things with GIS technology and help from our epidemiologists. So what you're seeing is really just a high-level snapshot of our ongoing campaign. We're halfway through, and we're going to carry on, hopefully, to bring us to the home stretch. Sorry, that's what I needed to do. Click several more buttons. I apologize for that, but that's how we've been able to target our influencers in their neighborhoods and where we have lower vaccination rates as identified by public health. Thank you very much.
Thank you, Sharron and Fauzia, for giving us such a fulsome update. And I know these are questions that and sometimes even suggestions that I get from the community. I'm sure my colleagues have as well. So it's great to see that this is very much a multi-pronged approach, and very often led by those community partners, Fauzia, that you and Sharron have referred to. And I think that's a real testament to the success, because it's never been just about the numbers. It's about the people and about targeting and focusing on priority groups. Mr. Lauckner, do you want to add any comments? Okay. Are there any questions, colleagues? Councillor Vrbanovic.
Thanks very much, Chair Redmond, and thanks to all of you for the presentations and the update and all of the great work that's been done. It was certainly great to see you, Fauzia, on the weekend and in person for like the first time in a year and a half, which was wonderful. And to see the great turnout that we did see. I do have a few questions, Mr. Lauckner, just in terms of ongoing targeting and so on. I noted in the presentation that we've got signage and bus shelters and so on, but have we actually looked at putting signage on our buses and on our LRTs? I know we have the capability of doing that, and that would see them actually moving around and not just being, in one place where only people living in those neighborhoods see them, or maybe if they happen to notice it passing by. Have we looked at that as an option?
Yes, so Madam Chair, we have. I actually don't know what the status of that, and perhaps Sharron or Connie may have an update.
Connie, go ahead.
Sure, through the chair, I think that's a great point that we can maybe take back and update council on, unless Sharron, you have specific information to share.
No, we certainly did look at it. We've looked at numbers, and we've tried with the resources we have. We'd love to make this grander as well and explore options like that. So it's a great suggestion.
Great. One of the, when we talked about sort of various ethnic communities, I mean, I ended up recording an ad in 10 different languages on the weekend. And then I actually posted something for the Croatian community in Croatian. And I'm just wondering how much we're doing reaching out to leaders in those different ethnic communities to post stuff amongst their particular communities, and using, the radio hosts, the leaders in different cultural groups and others to maybe do something similar if we're not doing that already. I was actually surprised, sort of the response that my Croatian one got, even from probably 2/3 non-Croatians that couldn't even understand it, and unless they put it into Google Translate. So I'm just wondering how much of that we're doing, and if we could look at doing more of that.
First of all, I want to thank you for getting the message out in 10 languages. That's pretty impressive, Councillor Vrbanovic. Fauzia, do you want to speak to the efforts we've made in that area?
Through the chair, thank you, Mayor Vrbanovic. I think it's a good point. I think we could definitely, is a growth area to do some more translated social messaging on social media. I think we've done a lot in terms of printed resources and fixed communications in that format, but I think there's definitely a lot of opportunity ahead of us, in front of us right now, to look at doing some more translated options on social media.
Yeah, because I do know that, unfortunately, there's a certain amount of hesitancy amongst the, I will say, 50 to 80-year-old age group from a variety of European countries, Croatians being one of them, but also Portuguese, Italians, and others. And, I think of someone like Antonio Brito, who runs the Sounds of Portugal radio show at CKWR. Like, anyone who's Portuguese in KW, maybe even Cambridge, knows him. And so, we got him to do a Facebook post, and or maybe even, between him and we did a bit of a Facebook ad buy with it. That could really push that message out to that community. So I would think about that, because those are groups that I'm in conversations I'm seeing and hearing hesitancy in terms of them doing stuff. The last 2 points I want to make is just around locations of service. And I know we've been using the community centers and so on more of a targeted perspective, and I understand some of the rationale behind that, because sometimes we have members of the community who may not want to go into a larger setting or into a setting that's going to have a lot more people in it. But I'm also thinking that making those centers, at least on occasion, more open, and bookable, could potentially, or at least walk-in listed as options on the website, could help us with hesitancy in those neighborhoods where we know the numbers are high. Have we looked at doing that even, on some days and not necessarily all days, so that you could sort of fulfill the needs of both groups? Because as an example, I talked to a young mother who got her first shot at the drive-through at Binghamton's, didn't know where to turn, didn't know where to get information, was a busy young mother. And I'm just, thinking there's others like her out there.
Mr. Lauckner?
Yes, to you, Madam Chair. It's a great question, Councillor. We talk about that every day, and I know the team, Vicky and the operations team, talked about it as late as this morning. We continue to work with those communities to try to understand what's best for them. There continues to be a lot of feedback that, to the point that you made, we need to be cautious in terms of the approach, and sometimes people want more confidentiality around the access to this particular service. So I think it's a good point. We'll continue to take that under advisement, and where possible, we definitely would take those actions. But again, it's counterbalanced with the ability to protect confidentiality where that confidentiality has been requested. So again, some people, I mean, just trying to be blunt here, some people don't want everyone to know that they're being vaccinated. It may not be supported in their family, but I do take your point that others would prefer booking, and we'll pass it along to Vicky and team, and hopefully can open up more of those opportunities in the weeks ahead. It's a great point.
Yeah, I think it's finding, as you say, that balance, and I think, you know, we can do it, but also the key, I think, is particularly amongst some of these populations is access, and this really gets to the last point. I mean, a lot of the stuff that we're doing, and I understand that our staffs are tired, but the reality is, I suspect that some of this hesitancy is amongst people who are just burnt out from working too many part-time jobs and trying to, you know, make ends meet. And so the last thing they're going to do is go out to Binghamton's, go like on the fringes in terms of our sites, and which works great if you happen to have a car and are mobile like the rest of us. But if you, it makes it difficult. And so I think as we start getting into that micro targeting, I think we're going to need to really look at doing some evening, late night clinics that respond to people who are working 2 or 3 part-time jobs, that are working shifts, and hopefully try to catch some of them there. I know it's not as efficient as, you know, when we did the after dark session in Cambridge, but if, you know, we're really trying to target some of these groups now. I think that's the kind of thing we're going to need to do.
Mr. Lauckner, yes.
Yeah, just concurring through you, Madam Chair, with Councillor Vrbanovic. The mobile and pop-up will be key to that, and targeting into locations and the flexibility of hours, as you say. We've got to make this easier, and the last mile is always the hardest, right? As you've said. So the next few weeks will be still, you know, increasingly difficult, and then our focus, as we said earlier, is on mobile and pop-ups and those kinds of things that you talked about, and your suggestions once again are great. So really appreciate it.
You know, just that made me just think of one before I pass over. One other possibility with Fairview and Conestoga open now, maybe you might want to think about using those 2 malls as potential locations, as well as the St. Jacobs Farmers Market and the Kitchener Market, just because, you know, in a day there's lots of people that come through, and even if we get, you know, a couple hundred on a Saturday in St. Jacobs, that's a couple hundred that we didn't have last week, right?
Once again,
Cambridge Center as well, yes.
Once again, through you, Madam Chair, that is on part of the plan with our bus and our mobile to those locations, and we actually wanted to surprise people with you maybe being there, but we'll let you know and the rest of council know when those things happen. So thanks again.
Councillor Galloway.
Thank you, Madam Chair. I don't think I have a question. I just did want to comment, though, that early on in the vaccine rollout, we were cautioned that we would need to do some special outreach and pop-up clinics and to deal with a lot of the diversity issues in our community. And I'm so pleased to see how much that we have been able to do, and largely unseen by the masses, because most people are most familiar, of course, naturally with the rollout of the vaccine in the large clinics or smaller clinics, or in their doctor's office, or quite a few pharmacies as well. But it's been so important to be able to get out into the various neighborhoods in the various communities. And what Fauzia and others have done is truly, you know, that the numbers may not compare to Pine Bush Clinic on a daily basis, but it's every bit as important to get out into those particular neighborhoods and those particular communities. And largely unseen, largely unheralded. I hope some of the media that may be on the call will pay particular attention I've had to explain this to a number of people who said, really, this is happening? And I said, yes, it happens every day. There's clinics, pop-up clinics in neighborhoods. And in fact, in some cases, some volunteers from various communities knocking on people's doors to get them to come down the street to a particular local pop-up clinic. So this has really been very, very special. And I just want to congratulate Fauzia and everyone else who's been involved in this, working kind of behind the scenes more than some of the large clinics, not getting, and it doesn't need that kind of publicity. That's in fact somewhat counterintuitive to its effectiveness. But I do think the community needs to know that this has been going on. You know, I hear today for the first time that we had a low German video. And I think what a great thing to have thought of and to have been able to utilize in a very specific community in order to incent more vaccinations and making it easier for people all over the region and in different types of communities who may not otherwise avail themselves of the larger services that we've made available to the masses. Congratulations and kudos. And I'm glad we were able to take the bushel basket off today of the great success of this particular program.
Thank you for those comments, Councillor Galloway. Councillor Foxton.
Thank you, and through the chair. When I worked at the clinic at drive-through clinic at Binghamton's, which was amazing, I loved it. You know what I noticed? Whole families in all age groups came. And I wondered about the parents who have young children that haven't got the time or availability to get out to get vaccinated. Because I saw them coming as groups and they were proud that they brought, mom and dad brought their teenage son and their grandparents. And the availability to do that, that was a wonderful thing. But I wondered if that's been a problem for some people. And who watches the kids when you go to get vaccinated, and especially if you don't have a big social network or a family network. And that's the one thing the drive-through allowed. Of course, you needed to be drove through. Wonder if we could take a bus through the drive-through, or a few buses through the drive-through.
I have to tell you, I tried to do a bit of a throwdown. I think there were, was it 6 or 8 stations? I think there were 6. And I went past one and there was a large station wagon with the back and there were 6 people in it. So I said to all the other groups who were vaccinating and taking the information, so there's the throwdown. That was the only car full of 6 people, all of whom were getting vaccinated that I saw. And I assumed were in the same family. It is really good news. The fact that this hasn't always been put in the front window has not been through neglect, but because we understood that there is that balance. As a couple of people, I think Councillor Vrbanovic talked about it too, of making sure that we're taking the service to the people as they want it and how they want it. And that's been totally led by the community. And I would say that that's been Connie, Fauzia, and their whole team being really good listeners and taking the lead of the community. And I really do commend you for them. That. And, you know, as hard and overworked as our staff is and our teams are in the vaccine clinics, I have to tell you that any of the ideas that you've come up with or that we've ever come up with, all we hear is, let us think about it. We think we can do it. And nobody gets more enthused than the people that are on the front lines every day, figuring out another innovative way to make sure we get more vaccines out. So we really have the A team working on this, and so I want to. So Sharron and Fauzia and Connie, who are on, and I think Dr. Wang is still on, and Bruce, you too. Not just in Shirley's absence, but you're on this every day. It is an amazing undertaking. So thank you for all the thoughts and the ideas and the questions. I see no. Sandy, you're applauding, right? Applause, a round of applause. This is a sitting O, which is almost as good as a standing ovation. I see no further questions, so I would now entertain a motion to adjourn. That is moved by Councillor Foxton, seconded by Councillor McGarry. Would you use your icons to vote? Or your hand if you're Councillor Kiefer, we'll take your hand. Thank you, colleagues. That is carried. And again, this is an amazing community update, and it's been done with a full, unfettered support of this Board of Health. So thank you all for being so steadfast in making hard decisions and making sure that we get vaccine in arms. Everybody have a great night.